Hello, everybody. This is Dr. Joe Holcomb, naturopathic physician. I am doing a follow-up video specifically about vitamin D and COVID-19. If you have not seen the other video about COVID-19 and the understanding the science behind it, I encourage you to go there and check that out so that you understand some of what's in this video. We will recover or rehash some of the what's in that video though as we go through this. Um, so vitamin D and COVID-19, is it helpful? So basic physiology. Physiology is how the body works, the biochemistry of what's going on inside of the body clearly lays out the need for vitamin D for immune function. Vitamin D blocks inflammatory cytokines and chemokines. These are cells that are causing respiratory distress with COVID-19. So the biggest issue that we talked about in that first video was a cytokine storm is what's causing respiratory distress and death in people that get COVID-19. Most people don't get that respiratory distress because they have enough vitamin D or vitamin C in their body to make sure that they keep the cytokines in check. So, but it's also interesting to note that not only does vitamin D block the inflammatory cytokines, which cause the overreaction, which leads to the respiratory distress, but vitamin D also stimulates antimicrobial peptides, which is each cell has the ability to protect itself. And these are antimicrobial peptides. This is not just in human physiology, this is in all of biology. All cell life has this host defense peptides. It's a big part of our immune function on a cellular level, and vitamin D actually stimulates that. Vitamin D is also responsible for stimulating what's called phagocytosis, which is the immune system's cells, and there's a variety of them, to actually go through a process what's called phagocytosis, which is a big fancy word that actually means cells eating. So cells that will engulf other cells that are gone awry, such as cancer cells, can be taken care of with phagocytosis. Bacteria and viruses also are eaten by our immune system, so to speak. And that's how our immune system fights. So vitamin D stimulates that to happen. Again, I don't see vitamin D being necessarily something that is going to prevent you from getting COVID-19. It sounds like and it looks like it's very contagious. We're all going to get it at some point. We just we want it to be like the normal flu instead of something big and scary. And if we can just get in a few things into our bodies, vitamin D being primary among those things, we can really decrease the cytokine storm potential that leads to respiratory distress and death, which is not where we want to go. So understanding the individual need for vitamin D. So this is the big thing that I really wanted to address with vitamin D. Everybody is different and everybody has different needs as far as the dosing that goes on. So this is another big fancy word I'm going to introduce to the general public here is called pharmacokinetics of nutrients. So pharmacokinetics is a big fancy word for the process by which a drug or a nutrient is absorbed, distributed, utilized, metabolized, and eliminated by the body. So basically, how does that nutrient or drug work in the body? What does it do? How is it absorbed? And how does it get metabolized and excreted from the body? So with vitamin D, this is important to understand because there are so many things that come into play in how vitamin D is metabolized and utilized in the body. So the dosing is going to be different for each person. Just to name a few of the big items, your genetics plays a role. Your nationality, your where you live on the planet plays a role. Weight plays a role. Those that tend to have a higher circumference of around their waist tend to need more vitamin D because of fat metabolisms issues. Activity level. The more active you are, the more vitamin D you're going to need. Liver function, gastrointestinal health, hormone balancing, thyroid function, stress levels, and the quality of the nutrients that you ingest are all keys for the pharmacokinetics to be optimized in your body. And of course, everybody knows about neurotransmitters and how vitamin D helps to enhance neurotransmitters, which helps with mood. So the seasonal affective disorder. So there's a lot of different functions in the body for vitamin D, not the least of which is immune function. So let's talk about what optimal levels are. Now, because vitamin D is a fat-soluble vitamin, meaning that it can tend to build up in the system, there is a potential for toxicity. Now, in the 15 years that I've been practicing medicine, I have only seen toxicity twice. And out of those two that I saw, only one actually had symptoms of toxicity. So while we tend to put don't take too much vitamin D, a little bit of fear on overdosing vitamin D, and as well there should be, we tend to way underdose it. So let's talk about what vitamin D levels in the bloodstream should look like. Now, the normal range, if you go and have your blood drawn by your doctor, the normal range for most labs is somewhere between 30 to 100 nanograms per milliliter. Now, optimal range for vitamin D is 60 to about 110 nanograms per milliliter. The reasoning for that optimal range is there is a lot of functionality between 30 and 60 that does not get met unless you get into that 60 range and above. So I disagree with quote unquote normal. I think we need to be up above 60 in order to have full functionality of all the pathways that vitamin D works in. And of course, for other conditions, such as fighting cancer, or if you have a viral infection, such as COVID-19, we even want to increase it higher, so 80 to about 130. Now you start getting up above 150, and then that's when you're in the toxic levels. So that's where I would kind of draw the line. Now with this, I do suggest you work with a doctor that is accustomed to working with optimal levels of vitamin D. Most doctors are not. They just look at the normal ranges. That being said, doctors can learn new tricks, so share this video with them. So how much vitamin D should you take? This is the question that has an answer that can only be given by studying your pharmacokinetics, how your body processes and utilizes your vitamin D. And the way that this study is done on an individual basis is very simple. It's just a blood test to see where your levels are at. And if you're, say, around 35, then I would increase your vitamin D intake for 3 months and then retest your vitamin D levels in the blood and see where the new normal is. And if you jump up to 130, then you may need to adjust the dose down a little bit to get it in that sweet spot. And the sweet spot is usually about mid-range. So if you're fighting a virus and you want to be in that 80 to 130 range, then maybe just cut the dose back a little bit. If you're trying to just be in the optimal range and you're at 130, then you may need to cut the dose in half or adjust it however. And then I would retest again in another 3 months just to make sure that you're getting into that mid-optimal range. The retesting is what tells us what your pharmacokinetics is and does. So that's the reason for the retesting. I am not a fan of just putting everybody on the same dose and accepting the same outcome, because that doesn't happen, because we're all very different in our pharmacokinetics. So, but if you say you increase your dose and the number only jumps to 45, then you have an increased need for vitamin D, and you should increase your dose again and retest again in another 3 months to make sure that you're hitting that optimal range. I hope that makes sense for everybody. Pharmacokinetics of nutrients is something that is new to a lot of people. Naturopathic physicians like myself understand it extensively. So find yourself a naturopathic physician in your area, and get a vitamin D level tested. And that can simply be done by going to any draw center. Any doctor can order, or nurse practitioner, or any physician can order a vitamin D test. I highly recommend that you work with somebody that understands the pharmacokinetics of nutrients, as we just talked about. There's lots of medical doctors and DOs that do understand. They usually call themselves functional medicine doctors. Functional medicine doctors are akin to naturopathic physicians in the sense that they're learning what we were taught in school. So I love functional medicine doctors, and if you've got one in your neighborhood, please utilize them. So let's talk about using a quality vitamin D3 product. The biggest issue by far is the use of soy oil with most of the vitamin D on the market. If you've got vitamin D in your home, go and just look at the label, and under the ingredient list, the first ingredient should be the oil base that the vitamin D is in. If it's soy oil, please throw it away. And you want to get a olive oil, coconut oil, safflower oil, sunflower oil. There's several oils. Those are probably the big ones that are in the good quality ones. Now, some of my favorites, I really like the Now brand because it's open to the public. It's easy to come by. It's cheap. You can buy it on Amazon. You can buy it at any of your local health food stores. They have one that is a vitamin D3 that is just 5,000 IUs per capsule. So that's easy to adjust the dose, as far as, if you need to increase the dose up to 20,000 IUs, then you just take 4 of them a day. And so if you need to decrease the dose to 10,000, then you can easily do that. Fantastic product. I really like the Now brand. I should have bought stock in their company years ago because I recommend them quite a bit. If you're looking for a more balanced type of vitamin D, and just for a few dollars more, Restorative Formulations is a doctor's only product, but you can buy it on their website if you just use if you create an account and use the authorization code, which is just my office phone number. Vitamin D3 Balance, it has vitamin K2 in it. And with vitamin D3, K2 does help to increase absorption and utilization within pathways in the body. So I do recommend usually getting a vitamin K2 in with your vitamin D3. That being said, if you're in a pinch, go with the vitamin D3 from the Now brand. It's fantastic as well. But the vitamin D3 Balance with the K2, that's my favorite. I like it because the capsules are 10,000 IUs each, and most of us need at least that a day to get into that optimal range that we talked about. So here at my office in Montana, if you happen to be local or traveling to the area, we're doing a vitamin D3 or a vitamin D lab. And a vitamin D3 injection for $50 for the month of April. and we may go into May. We'll see how things are as far as this COVID thing clears up. That's a really pretty good discount on the lab and the injection. And this is done at my DRIPS location. DRIPS is my IV center, located at the Cloud9 building in Kalispell, Montana. There's the address and the phone number to set up an appointment. We just want people to be smart about dosing their vitamin D. So I encourage you to work with somebody that knows the not just the pathophysiology of COVID, but also understands the nutrients of and the optimal ranges. Again, the optimal range that we want to get into is 60 to 110, and that's just for your normal everyday functionality. The 80 to 130 is if you are fighting something. So with that said, it's been my pleasure. I hope this has been helpful. And I encourage you to just keep a positive attitude and have fun and wave at your neighbors and smile. Have a great day.